When you get diagnosed with HER2 positive breast cancer, it is a long course. And even though many women are going to be diagnosed with what we think of as early stage breast cancer, where at some point treatment will be over, there's a lot of steps to it. And so most of these women are going to go through surgery at some point. Some may go through radiation. Many of them will be asked to do some chemotherapy. And most people, as part of that chemotherapy, will be asked to do other drugs that target that HER2. From start to finish, that drug process can take a year. And after that, a lot of it is trying to get back to normal and trying to get your body back into the shape that it was before treatment. So conditioning, whether it's exercise, diet, activities. I think people also during that period are navigating what side effects they may still be experiencing, and which of these are going to be temporary and which may be things that they're stuck with that they have to figure out, what can they do to ease that symptom. So some examples of that would be fatigue. There are sometimes symptoms that affect numbness and tingling in the hands and feet called neuropathy, and I think also energy level. After that active phase of treatment is over, you do continue to have visits. Generally, the idea is that we'd like for folks to follow up for a period of about 5 years after diagnosis. And that's going to mean anywhere from usually at least 2 up to 4 visits per year. And these are going to be times to both make sure your exam is okay, but also to report any kind of nagging symptoms, anything that's still going on that we either need to just investigate further or try to figure out, expectations around like how that, what's the timeline going to look like for that to get better. For women who have intact breast tissue, mammograms are going to be part of this follow-up. Oftentimes in the first 2 years after a diagnosis, you're going to be having those mammograms a little more often, so maybe up to twice a year. After that, gradually, you'll go back to that screening once a year. But you have these frequent exams so that in case you need another test, we can get that set up.